Hey there. Yeah, you. I'm talking to you. I wanted to come and tell you a couple of things that maybe I haven't told you recently. Um, you're doing better than you think. That's right. And you might be saying, what's she talking about? Well, let me tell you. Look, I know it gets hard. Whether you're trying to quit smoking, or maybe you're trying to lose weight, maybe you're trying to lower your diabetes numbers or your cholesterol numbers, or maybe you're trying to lower your blood pressure, but you don't feel like things are working. No matter what you do, maybe you're exercising your tail off and eating healthy and doing all this stuff, seeing a nutritionist, etc., but the scale won't budge. Or maybe you keep trying to quit smoking over and over again, but you find it difficult. Or, maybe you're trying to get off some medications, your blood pressure medications, your cholesterol medications, diabetes medications. You're trying to eat healthy. You're trying to follow all those healthy diets and all that kind of stuff. But despite what you feel like you're doing, it's not helping or working enough, in your opinion. It's times like this that I think are particularly discouraging. It's easy to get discouraged. And let me be the first to tell you, rather, you're not alone. If you feel like anything I just described, where you feel like you're trying and you're trying and you're trying and you're trying, but you keep coming up a brick wall. It doesn't even have to be your blood pressure, diabetes, cholesterol, etc. It could be your mental health. It could be something else. Okay? It doesn't really matter. But whatever it is, if you feel like things aren't getting any better, it can be so discouraging. But I'm here to tell you once again, you are doing better than you might feel. And even if that needle is not moving in a way that you can see appreciably, I can tell you that the commitment that you have made and that you are making to your health and to your body is a huge thing in and of itself. That is movement in the needle in and of itself. And I also have to say this too, I don't want you to get discouraged if you don't feel like you're able to fix everything on your own. I often have patients where maybe they're on diabetes medications or cholesterol medications or blood pressure medications. They try their darndest to get off of them, to lose the weight or to lower the cholesterol or to lower the blood sugar or what have you. And maybe they're not able to do so to the effect that they'd like to. Maybe we're not able to take the medications off, or only a few, or what have you. Lower the dose a little bit, but it's not as much as they want. I don't want you to take it personally. Yes, we all have personal responsibility, but I also want you to remember, guys, you also have something called genetics, right? A family history that you're not totally in control of. I have patients that literally weigh 80 pounds soaking wet, and then they have high cholesterol. Not because they're not doing everything right, but because they have a family history. Because they have a genetic predisposition that may be stronger than someone else's. I'm not saying that if you're not able to sort of get your numbers where you want them to be, it's because of genetics and, it must not be you. What I'm saying, though, is that there are a lot of factors involved. And I don't want you to get discouraged. I don't want you to give up. I don't want you to give up hope. And I don't want you to think that you're not enough, that you're not doing enough, because you are. I want you to give yourself credit and give yourself grace. Yes, keep working on your health. Keep working on all the things that you know to do. Make sure you're talking to your doctor about what's working, what's not, what you're struggling with, what you're not struggling with. But throughout this process, make sure you're kind to yourself. Because honestly, as a family doctor who, unfortunately, I'm not your family doctor, but as a family doctor, I am just happy that you're committed at all, because I know how big of a step that is. And I need you to know that too. So keep trying. Don't be discouraged. Know that you're doing better than you think, and know that it's going to be okay. Work with your doctors, your healthcare providers. Let me know in the comments if there's something that you're working on, something that you've been struggling with, or something that you're trying to improve or get better. Because I always say this, what you write in the comments always helps other people. So this is just like my little pep talk to you guys, because I love y'all. Guys, I'm Dr. Jen, practicing family physician, on-air health expert, and video creator. Even though you're not my patient, I do wish you were. This is what I tell my patients, so I wanted to tell you too. For those of you who send stars, I respond personally. You're so sweet. Thank you so much. Guys, I'm Dr. Jen. I'll see you soon.